we're back with part 2 of the series where we are talking about shoulders. We've recently launched the new Center of Excellence here at Jehangir Hospital, the Shoulder and Sports Injury Clinic. Last week, if you did join us for part 1, we were talking to the star, that's Dr. Nilesh Kamat. We talked about everything about the shoulders, the surgeries, whether you need them, whether you don't need them. We talked about robotics, we talked about the future. And today I've also got Radhika Patil, who is the physiotherapist at Jehangir Hospital. She's the head over there. And we've managed to keep Dr. Kamath as well before he could run away from more surgeries, or rather not surgeries for some patients as well. So today's series is going to be talking about a little bit about the prehab and the post-hab or rehab or whatever you want to call it. So I thought we have an interesting discussion where there's always the rehab portion that people tend to maybe forget or overdo. So I thought it'd be interesting to have both of you talk about that aspect and have an interesting discussion about where we go about how people should be looking at that. So thank you for joining us, Radhika. Thank you for staying on, Doc.
Thank you. The pleasure is all mine, but thank you for having us over.
Absolutely. So first question, what is the importance or the interplay between the surgery and the rehab portion?
Well, I think the easiest way to look at it is if you're undertaking surgery, it's like going on a journey. And if you don't do a rehab, you're not finished that journey. You're leaving it midway. You've not reached the destination.
Yeah.
I might do a swell job. I might do a great job getting the repair, getting the things sorted out. But what I need good physio to go hand in hand. Because when it comes to shoulder sports injuries in these scenarios, it's not just the surgical part. It's not just the implants. It's what happens after that. That is something very important because that's where dynamics, biomechanics, motions, this comes into picture. And I think the physiotherapist's understanding for that is the maximum. Because we might be seeing the patients for probably a 10 to 15 minute consult, but they are the ones who really understand the patients, understand the problems that they encounter on a daily basis, simple things like dressing, undressing, and they are the ones who can guide them.
Yeah.
So I can't really further emphasize the importance of physiotherapy because a surgery done without physio is an incomplete job done.
So this might be a tough question to answer as a doctor, but how much of the success of your surgery would you attribute to rehab?
Oh, okay, actually, massively. I mean, honestly, they are probably the way to look at physiotherapy is they are the ones who are the backstage workers,
Right.
We are right there stealing away all the glamour.
Right.
But yes, it's really important to have a good physio team, and I can really vouch for this because we have seen in Jehangir Hospital physiotherapy department really evolve. What earlier was very general physiotherapy, so earlier what was considered to be just generic movement and exercises, that has changed rapidly. There's a lot of emphasis on scapular positioning, that is shoulder blade positioning, getting the right dynamics, restoring biomechanics, and more importantly, not allowing the patient to have pain which they can do away with.
Yeah, Radhika.
Yeah, well, I'd like to add to that. Thank you for the vote of confidence. And
Well, hopefully we like to bring some glamour back to physiotherapy as well. I know with someone like Radhika, there's lots of great feedback. The people that swear by her, so I can tell you that there's definitely a lot of glamour that comes your way as well.
I would say that physiotherapy and surgery are, well, almost mutually exclusive but completely complementary. So once these two together would establish a kind of a continuum for the patient's recovery.
Yeah.
And whether or not you have surgery, you certainly want the patient to be seen by a doctor because that is where the diagnosis actually happens. That is where we get our pointers as to what we need to do, how we need to tackle a certain situation. And that being said, I think we've become much more involved with the journey of each patient where we keep on, following them up, looking at what went wrong, what went well.
Yeah.
And that's how we keep adapting to what needs to be done for a particular patient. But as doc said, definitely we look more at posture. We are looking at where every part or every segment of the body in relation to
A little more
each
specialized, more
other.
functional.
Yes, so
Right.
and functionality is in the end, at the end of the day, very important because life is long and you might want to do something different, something new at every stage of your life, and nothing should really be holding you back
right.
from doing that.
I suppose the perception has always been that rehab is always like a post kind of thing, post surgery. But there's a lot of stuff that we talked about actually before we got on screen, is that there's a lot of stuff that can happen before, like from the preventive side, or injuries that come to you that may not even require surgery. So what are the kind of most common sports kind of things, on not sports, or are you seeing a particular
Well,
trend in that sense?
Yeah, so if we talk about prehab, that's slightly a little different because people for prehab are coming in when you've already planned a surgery or when you're trying to prevent a surgery. So,
Prevent a surgery.
yeah,
Okay.
so probably a doc would give me a trial that have this patient for like 6 weeks, 4 weeks, and then we'll see how he's progressing.
But a
and
patient with
whether-
someone who has like pain or something like that, or
Yes,
like
yes,
symptoms
of
of
course,
something.
there's an injury at the
Right. So
root of it all.
let's take an example. Right?
Yeah.
Let's say day 0, someone's fallen on, say, a pickleball court or on a football ground, has sustained an ACL injury.
Okay.
Comes to me, gets an MR done, has a diagnosed ACL tear, right?
Right.
Wants
Okay.
to get back to sports, is willing for surgery. Am I willing to operate on day 1? Answer is no.
Okay.
Right? Why? Because in an inflamed hot joint, you don't want to touch them surgically.
Fair enough,
Because
yeah.
it's well proven that when you operate after a period of 2 to 3 weeks or 3 to 4 weeks, when the joint is silent, the inflammation has settled down, the recovery is much better. Now, what we need to understand is, if nothing is done in this intervening period, the muscles undergo a disuse atrophy and they lose their
Lose a
tone.
muscle or whatever.
So
yeah.
we don't ask them to get back home. We ask them to go and see the physiotherapy
Right, okay.
department, where they would guide them how to get your range back. Because on day 1, they could barely probably move 0 to 20 degrees or 0 to 30 degrees.
Okay.
But a prerequisite for surgery would be to get your range at least to around 0 to 110, 120.
Okay.
Until there are very specific condition. If it's a locked knee, then it's a different story.
Okay.
But long story short, the muscle tone is restored. You allow the inflammation to settle down. The patient feels confident. So when they are getting into surgery, they also know what to look into.
Interesting.
Also, psychologically, I feel the fact that they have been visiting the hospital, they know their way around, that sense of confidence
Okay.
goes up. Right?
Right.
So it does play a role in mental
Interesting.
health.
I didn't think
as
about
well.
that aspect.
So
Yeah.
that's because imagine you enter into a place on day 1. Let it be a new workplace also. You are insecure. When you keep going the same place over and over again, you just have a sense of comfort when you know the people around you who are going to treat you.
Yeah. Can you imagine if you're coming to day 1 to a place where someone's going to cut you up?
Exactly, on the next day. Whereas
Okay.
there is this team who's hand-holding you into the surgery, and then
Yeah, it's-
you're already telling them that what's going to happen afterwards.
It's like preparing someone for an exam.
Exactly.
Very true.
I didn't think about that aspect. That's a very cool prehab, or is
Yes.
aspect of it that perhaps a lot of people don't think about.
Yes. And your second question was about preventing injuries.
Right.
So I think that is extremely important because a lot of times I see, especially in schools or even in athletic clubs, they don't pay too much attention to what sort of warm up you should be doing or what kind of movements you should put your body through before you start actually getting into the sport. A lot of coaches even now feel that driving children or even children who are growing at that age, just driving them hard and enough is basically what is required to get them better at the sport. But things are not like that anymore. If you look at elite athletes, the way they do things and the way they train themselves is very, very specialized. You want people to go through certain movements. You want muscles to
Yeah.
adapt to how you're going to load them later on. So that's why I think prevention of injuries, making sure that people are following correct biomechanics, People are, using good alignment of their body segments. All these things play a huge role in
Right.
preventing injuries. And we just basically, as physios, we are making them aware of their own bodies. We're just showing them in the mirror, look how your knees are holding up to a
Yeah,
simple
right.
jump. So,
So if it's okay, let me just expand on that.
Please.
Take the example of tennis. In
Right.
tennis, although it's a racket sport, you're going to generate the momentum and the force from the ground reaction force. So your core strength and your stance is something which is very important,
Right, right, right.
Now, if you don't pay attention to that, if coaches will always say slightly bend your knee, get your stance right, get the ground reaction force, and then generate the power. Now, if you don't do that, and if you try to hit or use only your shoulder muscles, you're bound to have an injury, especially when it becomes a repetitive phenomenon. So, small things like maintaining the core, and core is probably important in everything that you would want to
Absolutely,
do.
yeah.
So, let it be hip surgery, let it be shoulder surgery, let it be knee surgery. If your core is good, these patients will recover faster. Right.
Okay.
So that's where I think preventive medicine or preventive physio,
Okay.
rehab, all of this comes into picture.
Okay. Well, coming to the recovery side, where are things that, in your experience, you find that people make the biggest mistakes in their recovery? Like what causes re-injury or slows down their recovery?
I think they're too impatient.
I think compliance, right? Because everyone wants to get back to
Fast.
activity ASAP.
Yeah.
But that's not what the reality is. Because you might do a repair, you might get range, but are you back to your pre-injury status? So let me give you an interesting fact. Now there's a difference between return to sport and return to performance. Now let
Okay.
me explain
Yeah,
this,
yeah.
right? Return to sport is you feel confident, you're playing. But return to performance is where you are performing at the pre-injury level. And the return to sport might be as high as 85 to 90% in certain series, but return to performance can drop as less as 65 to 75%.
Okay. Interesting.
So you see that there's a huge gap out there. So it's not just about playing, right?
So-
you want to play it the right way.
Yeah, interesting you say about this gap. Was actually I was going to ask this question about this. I read this now. You can correct me if I'm wrong. Is that typically muscles versus ligaments and tendons. Muscles tend to recover or grow a lot faster compared to ligaments or tendons. So, from what I've read, you can correct me if I'm wrong. Is that a lot of people develop they develop the muscle a lot faster after an injury. So after 3 months, as you said, they get impatient and they feel like their progress is great, their muscle has grown. So at that 3 month mark or whatever it is, 3 months, 6 months or whatever it might be, they feel that, oh great, I've got my performance back, etc., etc. But the ligaments and tendons that were actually injured haven't progressed or recovered as fast. So there's a perception that, I've actually recovered and therefore, they end up pushing and then that leads to a re-injury because there's that mismatch between the strength of the tendons and ligaments versus the
That's
muscle.
right.
Is that true, or is that what a lot of people cause a sense of I'm actually going a lot better than I am kind of thing?
Okay, so if I were a patient, I would prefer to have a fracture over a muscle injury over a ligament injury. Okay, so that's
Yes,
the way
that's
I would look at it.
agree.
Okay.
And why so? Because bone is going to heal back to bone full strength.
Right.
Muscle is going to heal back by scarring. It might get tight, but you still are able to regain the strength by
Yeah,
compensating, right? Ligaments are probably the most challenging part because you're getting soft tissue to heal to bone. And we don't have a scientific answer to that.
Okay.
Right? Also, if you look at the middle section, the muscles. Now, why again physio is an integral part? Let's say you have a grade 1, grade 2 hamstring pull or any other muscle pull.
Yeah.
When a muscle tears, there's going to be a hematoma or a blood clot formation. That blood clot formation is going to incite an inflammatory reaction which lays down scar tissue. So this muscle is now tight.
Okay.
And if you want this to perform well, that's why you need to stretch it out so your scarring is minimum. So your scarring is minimum, your strength is better, and that allows, or rather, does not allow you to have a re-injury. Right? So if you rush back early, that's not good.
Right.
Coming back to your question with a perception that am I stronger? So I'll give you the same example of an ACL surgery. The
Right.
graft that you put in, your own ligamentous graft, at day one, it's much stronger even on lab testing to your native ACL. But understand at that point of time, it's an avascular structure. That means it does not have blood supply. You're taking
I
a muscle
see.
from another part and you put
This-
it to
yeah.
another part, which allows for ingrowth of collagen. It undergoes revascularization. So typically at the 4 to 6 month period, it's come back to either its native strength or it's actually weaker.
So
But
it
patients-
dips around that 6 month period.
True.
Interesting.
It drops down and it's weaker. And if you feel that, okay, because I have full range and I've waited long enough and it's been 6 months, let me get back to sports. This is the window period where they can land up with a
Oh,
range.
wow. So it's like a graph going in
It
both
actually
ways.
drops down and then it escalates up.
Oh, that's so interesting for people to know.
True, true.
That's why we talk about 8 months generally
I
when it
see.
comes to knees and ACLs.
Right.
And there's a lot of muscle wasting, right? So again, when your muscle is going to shrink post surgery, you need to kind of get that muscle bulk faster.
Yeah.
And without the muscle bulk being as good as what it was
Was
pre-injury or comparable to the opposite side. And that's why in physio they have specific modalities. I'm sure she can expand further
Right.
on that, but that allows these patients and athletes to come back to their pre-injury status. It's not about just getting your range of movement.
Yeah, and there now apparently faster ways to do that. Like I've been hearing things like this thing called blood flow restriction or blood flow. Is that what it's called? BFT.
BFR therapy.
Can we hear about?
What actually happens is there is a lot of pain, there is a lot of apprehension about, my knee will give way again. And even though there has been a surgery, people are not confident enough. And then it's really hard for us to, at the initial stage, load the knee too much. So whether it's the knee or the shoulder,
Right.
whatever else that has been operated upon. So you want to start with low weights, but low weights basically don't give you those kind of results. So you don't see a good muscle bulk coming up
Yeah, what
with really
Doc
low
was just
weights.
talking about bulking
And that
parts, yeah.
is where these therapies can come in really handy, because what you do is you restrict the flow of muscle, blood to the muscle, and then you're working out with moderate amount of weights.
Right.
And what that does is it basically forces your muscle to recruit more and more muscle fibers,
Okay.
all the ones that have been kind of asleep for so long. And that's how we start bulking up the muscles.
Oh, interesting.
So,
It's like you're simulating what would be a higher weight for
correct,
a low
correct,
for
absolutely.
someone who
So
can't
with
do that at
much
this
more
point.
moderate weights in within our gyms, we're able to achieve a lot more than what we would do if we were just using regular weights.
Right.
Another therapy is muscle stimulation, because initially because of all the reasons I mentioned, there is a lot of muscles don't respond as quickly as you would want them to. They're kind of in a state of paralysis. Is there a better word for it? But
Atonia probably would be the right thing. They lose
Atonia.
their tone. So
and that's the reason why we want to wake them up a little more, and that's where electrical muscle stimulation comes in. So we have these little devices where we just put electrodes on the muscle belly, and then we are getting a good muscle contraction by passing electrical
Okay.
currents directly into the fibers. So that is where it helps the brain establish that connection, that this is what is expected out of the muscle, which has been inhibited because of the pain for so long. So these are therapies that
Interesting.
we are using.
So I mean, in theory, sorry to interrupt, but that sounds like could I watch TV and have this going and it's like as good as a workout for me?
Well, no, I feel I have found much better results when you do a really concentrated effort and you're actually looking at and concentrating on what is actually happening. And in the later stages, we ask the patient to contract voluntarily along with the machine. And then wean off the machine on the side.
Okay.
So that's how you pass the baton basically. to
That
the
muscle mind connect
that's
part of it is also.
neuromuscular coordination.
Right. Okay.
Yeah.
Let's talk about something that we haven't really covered upon so much. Is more about the psychological and emotional aspect of that recovery process. We kind of touched upon it. The psychological state needs to be obviously very positive. How much have you seen of that being an effect on someone's recovery?
Can I say something?
Yeah, sure.
So, why I asked to talk before is that I have seen how what happens when a patient actually goes to doc. As per, I've been there for so many of his consultations.
Right,
and
right.
They're listening to how he's speaking to them. So, right from the time where he is explaining what's going to happen, he's showing videos what's going to happen,
yeah.
which is the muscle, what am I going to do, what will happen later, and then he sends the patient down to us where we are walking them through all these procedures. I think it does a lot to reassure people
Absolutely.
as to that they are in good hands and they are about to be treated the way they should be, and because of that I think they gain a lot of confidence.
True, true. One more thing, if I were to add to this, when it comes to the elite athlete, right?
Right.
It's a totally different world altogether.
Yeah, I can imagine.
Because what we don't realize is the years of effort. One small trivial fall has pushed them back
Right.
many years, right?
Absolutely, yeah.
Trust me, whatever athletes or any number of athletes that I've operated, whenever I have advised surgery, even before understanding the pattern of trauma or the type of pathology, the first question that would be thrown at me is when can I come back, right? So that's the first thing that they want to know. And it's interesting, we had this ISACOS meeting earlier where there was interaction with some of the international athletes. And
Okay.
what they had to say was really, really worthwhile, because your body might physically be ready, but mentally you're completely crushed.
Yeah.
And we don't look into that.
Exactly.
And what as surgeons sometimes we don't realize is that we probably operate every single or every other day in our lives, right? But for a patient or for an athlete, it's a once in a lifetime episode, right?
Yeah.
And for them, it's 100% strike rate. You do well or you don't do well, right?
Yeah, absolutely.
I might talk about this return to sports, return to performance. I might give you statistics and code numbers. But for that patient, if he or she does not return to sport, it's a 100% failure. So we have never looked at it from that perspective. So for every athlete, it's either 100%
Or zero.
or it's zero.
Incredible.
Right? You don't lie in that spectrum in between. So
Which is why, again, that psychological aspect is just so important.
True.
Right. Okay, well, I mean, we talked about a whole lot of things, and I'm sure we can go on and on. But, since I've got both of you all together, I thought we can do a little quick rapid fire round, which may get controversial. So we'll have to see how that goes. First question. Most common excuse for skipping rehab by patients?
It's too hard and it's painful.
Let's see. I've got a whole lot, but I will
Well,
get to
that's
that.
a myth, but yeah, that's what people think.
What is the most common gym injury that you're seeing right now, or sports injury that you're both seeing?
I see a lot of back injuries.
Back
A lot of back injuries, and I do see a lot of shoulders as well. Lifting weights too much and in with bad postures.
Okay.
So overuse related shoulder injuries are probably the commonest, because everyone's active nowadays. Everyone would likes to play over weekends.
Yeah.
But if you don't warm up, if you don't understand that what is the right way to hit the ball, to strike the ball, to have a follow through, it results in injuries. It's not about getting the ball or the shuttle on the other side of the net. It's about doing it the right way.
Okay. One movement almost everyone should be doing more of, or one exercise, if you had to pick one.
Core strengthening.
So you mean strength training?
Core strength, yeah, absolutely. You need to work on your core, and you don't need a fancy gym. You can
Right.
do a plank at home. You can do a lot of things at home which will allow your core to build up, right? But core strengthening, according to me, and why am I saying this is because we see the entire spectrum, right? The younger patients have decent core because they have been doing some kind of activity. But elderly people who don't have core, even after a hip surgery, they struggle to get back to normalcy. Those who have good core are way faster. So even from a geriatric perspective, later on, if you want to avoid injuries, it's important that you need to do core and some amount of weight training for sure.
Fully agree.
And gym goers as well, I think they overlook core completely.
Yeah.
They have
Yeah.
legs day and arms day, and there's no core.
Oh no, no go. Okay. Most underrated part of recovery, you all feel?
Rehab. I'm only on blink a little to answer that. Rehab is the word, right? People think surgery done, job done. No, rehab is equally important.
Okay. Most underrated part of recovery. Yes, that's true. We're going to glamorize the physio side, as we said. Okay, so final couple of rapid fire questions. I said we have to end on a somewhat controversial note. One thing surgeons wish the physios understood better.
Okay, I think probably understanding what has been done on table, right? Because every injury,
Like they've done the right shoulder instead of the left shoulder.
no, I wish it doesn't get that bad, but no, but every tear pattern is different, right? So one size does not fit all.
Right.
I might have a small traumatic tear, I might have a big traumatic tear. The rehab is going to vary. A small rotator cuff repair, I wouldn't even immobilize them. I would get them to use the arm as soon as possible. A big tear, I would protect them. And probably that's where a dialogue between the surgeon and the physio more frequently
Right.
is something which will aid the patient in the time to come.
Okay.
Right.
Well, I'll ask that question to you. One thing the physios wish the surgeons explain better.
So yes, exactly that. That if they could take just a minute to tell us what it is that they've done and what it is that they expect.
Right.
So that would be amazing because, and then of course, I don't really wish to take up too much of time, but then we always, like to communicate through WhatsApp. We send a few videos.
Right.
And just that they stay in touch and they know what we're doing and they expect the best out of us. That is what would be wonderful.
No, but honestly, at Jehangir, I think that's one thing which I need to highlight because the entire physio team, not just her, but if they are in doubt about what needs to be done,
Right.
they don't hesitate to call up.
Yeah.
A quick word, probably even a 30-second call that, am I allowed to weight bear? How much movement should I do? Is the patient okay to get off the sling? Just a couple of questions also.
Makes
it
such a big
prevents
difference,
a major complication for the patient.
And I think that's what we do well is that we don't treat it one or the other, so to speak. It's not like surgery is one thing and rehab is another thing. It's really just, and from what we talked about today is that I think more and more people are realizing it's one thing.
It's hand and glove. Let's put it like that.
Yeah,
right? So
absolutely,
that's
yeah.
how it would be, right?
Or shoulder and sling or whatever you want to say. Any last thoughts that you like to leave us with? Anything that you think that we haven't actually spoken about that you like to people to know, or important message that you like to leave us on?
Well, I think today is an era of speciality.
Yeah.
And everything is not about general surgery, general orthopedics, and likewise, even rehab is not general rehab. We are blessed to have a dedicated shoulder and sports injury rehab team with us who can really concentrate on these injuries, the surgeries, and get them back to normalcy faster. So I think that's something which needs to be emphasized for patients and generally the masses, that you can't just assume that any XYZ can take care of the same problem. You need to go to the right person for the right problem, and then you can expect a good outcome.
Right. Okay. Thanks so much, Doc. I think we let the lady have the last word of the day.
Absolutely.
Well, just for the people out there, I think it would be really nice if one would get a little bit interested in being active, moving around more, understanding the body a little more, allowing your children to move more,
Right.
and that would really help solve a lot of problems for all of us.
Lovely. Well, Radhika, Dr. Kamat, thank you so much. I think it's been fascinating having this cross-functional discussion. I think people have learned a lot and got a great insight about hopefully injuries that they don't get, but if they do, they know where to come and how it can be solved in the best possible way. So thank you so much for being here.
Thank you. The
Thank
pleasure
you.
is all ours. Thank you.
Thank you.
Thank you.
Thank you. Join us for the next week for the third part of this series where I'll be talking to Radhika a little bit more detail about rehab, prehab, stuff that we've already talked about today, but hopefully with a little bit more insights on what she gets into. So join us for next week. But before you do leave, do not forget to hit the like and subscribe button here at the bottom. Any comments that you've had for today, in the previous comments, or previous episodes, do let us know. We're always happy to hear that. And we will see you for next week's episode.